Hello, everyone. We will get started with Module 9 of the COVID-19 Vaccination Certificate Program, a booster shot to the pharmacy workflow, promoting health maintenance and best practices to encourage vaccination in the community pharmacy. This is Module 9 of the 11 webinar series, and I'm excited to present this to you today. My name is Dr. Christopher Gillard, Clinical Associate Professor of Pharmacy here at Xavier College of Pharmacy. My information here, my email address and phone number are here. Please feel free to contact me if you have any questions. I had the pleasure of meeting with most of you during our focus groups in fall 2021. I'm excited to offer this presentation. Hope you get something out of it that you can take to your practice in the community. Christopher Gillard, myself, I have no relevant financial relationships or commercial interests to disclose. This presentation is for CE credit, is worth 1.5 contact hours. So let's go ahead and get started. The objectives of today's presentation are to discuss the pharmacist's role in health information, vaccination, and health promotion. We review evidence of the pharmacist's impact on improving vaccination uptake in community settings, identify ways pharmacists can promote vaccination health maintenance to patients, discuss strategies to incorporate vaccination education, and promote COVID-19 vaccination in the community pharmacy workflow. So let's get started with the pharmacist's overall role in health information, vaccination, and health promotion. The first thing we have to note, first of all, is the pharmacist's role today versus the past has definitely shifted from dispensing roles of medication to a more comprehensive patient-centered medical model of care. We require more application of our advanced knowledge and clinical skills to have an ability to have a positive impact on patients' health. As the pharmacist's role expands, pharmacists have become a key part of the patient's care team. Regular touch points and personalized services enable community pharmacists to make a considerable impact in patient outcomes as an integral part of the patient's healthcare network. In today's role, pharmacists have many different roles. Major core ones, of course, dispensing. Some will say our role in dispensing has increased as people continue to get older and require more medications to meet their chronic conditions, and more of our patients are living longer and require multiple medication therapies. With counseling and education, a lot of our patients will often speak to their community pharmacists first for health advice or recommendations, and also education about their health and medications. Disease prevention and health promotions make up a part of our roles as a part of the community pharmacy practice through health and wellness calls, first fill and refill calls, and also through vaccination. So our role has definitely expanded in today. And we think about the role of the COVID-19 pandemic, community pharmacists are definitely on frontline workers, and they definitely should be acknowledged. So things community pharmacists have done during the pandemic, we've been able to provide chronic medication renewal or accessible healthcare providers during this time when maybe even some physician clinics were closed. Clarify misconceptions about health and wellness, maybe even vaccinations, screen patients for COVID right around the corner at their pharmacy. Provide recommendations of a minor ailment consultations, monitor and manage chronic conditions, and provide telehealth services. So our role has definitely shifted in the COVID pandemic, and community pharmacists are indeed healthcare frontline workers, and they've been very impactful in taking care of patients during these challenging times in the COVID-19 pandemic. Why has the pharmacist's role expanded? There is a lot of evidence that pharmacists, as a part of the healthcare team, have led to better drug therapy outcomes in the community setting and also inpatient hospital settings. Pharmacists, as a part of the healthcare team, led to better drug therapy outcomes that are reduced costs. Pharmacists often have more contact with patients than the other healthcare team members. The role continues to include direct patient care as members of integrated healthcare provider team. So there is evidence indeed that pharmacists have a role and actually have a positive impact on patient care. This is through increased vaccination rates, patients becoming more aware of their medications with proper use because of pharmacist education and counseling. And also pharmacists have been shown to reduce hospital ER visits and also reduce hospital length of stay. So our role has been acknowledged or recognized as having a positive role on patient care. And again, we cannot forget, pharmacists remain trusted healthcare professionals in the United States. They are recognized for high honesty and ethical standards. Americans continue to view their pharmacists as highly trusted and well-respected professionals. Pharmacists have maintained their rank as the top 3 professions, or the top professions spot they've held for 11 consecutive years. So why are pharmacists considered trusted health professionals? 3 major themes come to mind: medication expertise, accessibility, and goodwill with consumers. Again, pharmacists are readily accessible in the community, often strategically located in the community, where in some cases it may not be as easy to get in contact with other healthcare providers. Also, over the years, a lot of community pharmacists have fostered relationship with patients, and that has led to increased trust as well. And also, several of our pharmacy leaders have now acknowledged that pharmacists are trusted health professionals, and there is a benefit of pharmacists as part of the healthcare team. So Stephen Anderson from NACDS, patients trust pharmacists and rely on the accessibility. Studies show that patients are more likely to do the things that keep them healthy when they have access to pharmacists and pharmacies. Also, Douglas Huey, CEO of the National Community Pharmacy Association, states it's time for payers and policymakers to better utilize the accessibility and expertise and public trust in pharmacists. So our leaders are definitely acknowledging the role pharmacists have as part of the healthcare team. So what has been the role in health information for pharmacists? Pharmacists can have a positive role in providing health information. They can provide information aimed at changing descent to more informed consent in patients. They educate people on the benefits associated with immunizations, risk and common vaccine side effects. They can educate patients on making sure the immunization schedules are met, and also promote seasonal vaccination campaigns and monitor and reporting adverse reactions from vaccines. This is one such example here of a study in which pharmacists had a significant role in providing health information and education. This study was published recently. It was a study that talked about increasing adult immunization rates in rural states through targeted pharmacist education. This study was conducted in North Dakota in the US. The purpose was to assess if an educational program developed for pharmacists could increase pharmacists' delivered statewide immunization rates. So the North Dakota State Health Department developed and provided pharmacists with educational tools and a toolkit and provided immunization certifications for pharmacists. And they were supposed to use this information to educate patients and hopefully improve vaccine uptake. In this study, the results, the number of vaccines administered in the state of North Dakota increased by almost 4,000 doses. And overall adult immunization rates increased throughout the state. So this study suggests that focused education and resources delivered by pharmacists can increase pharmacy-based immunization rates and also adult immunization rates overall. We have some important milestones we want to acknowledge as well too. In the early 2000s, pharmacists in all 50 states were able to provide adult vaccination. And we have a more recent milestone in 2020. This was birthed from the COVID-19 pandemic. Pharmacists in all 50 states are now allowed to give childhood vaccinations. This push came from the United States Department of Health and Human Services. They recognized that childhood immunization rates were starting to decline during the pandemic. And it took steps to use emergency powers during the pandemic to allow pharmacists to get pharmacists' ability to provide childhood vaccinations. And the purpose was designed to help prevent vaccination rates from falling any further in the COVID pandemic. So we now have 2 major milestones as we are vaccinators at this particular point in time. So let's talk about the pharmacist's role in vaccination. Community pharmacist-based vaccination services have demonstrated success in increasing levels of vaccination uptake. Patients eligible for free vaccination services and physician or doctor surgeries chose to pay for this service in a pharmacy because of the following reasons. So a lot of patients are saying eligible for free services from a doctor's office would rather pay to receive the service from a pharmacy for several reasons. Pharmacists have more flexible opening hours versus MD offices. There's also more walk-in or appointment opportunities for vaccination at the pharmacy, and also pharmacy location accessibility are major roles why patients would sometimes rather receive their vaccination from the pharmacy versus a physician or doctor's office. A pharmacist's recommendation to be immunized has been shown to have a similar effect on a person's decision to be immunized as that of a physician. So the pharmacist's voice is similar or is as strong as other healthcare providers in making patients think about getting vaccinated or influencing vaccination decisions. Now we must summarize the pharmacist's role in vaccination, and it includes many different areas. So pharmacists administer vaccines and host others to administer vaccines. They conduct immunization screening and history, counsel patients about vaccinations, document vaccinations given. They manage formulary to make sure vaccines are stocked well. And also they may have some administrative roles and also public education about vaccination. So the role of the pharmacist providing vaccination has several different aims. The American Society of Health System Pharmacists has identified several ways in which pharmacists in both the community and organized healthcare settings can minimize vaccine preventable disease through these different routes. And we also can see there is a worldwide impact of pharmacists in providing vaccination. So in Australia, of the patients electing to receive a vaccine from the pharmacist, almost 14% had never previously had an influenza vaccination. Pharmacists administered vaccinations were well accepted by patients who also expressed a high level of satisfaction with service. Greater than 95% were happy to return to the pharmacist for vaccines in the future and would recommend a pharmacist-led vaccination service to others. So here we have one worldwide example of where pharmacists have impact on vaccination services. Also in Canada, pharmacists in most jurisdictions have some level of authority to inject vaccines in a community pharmacy. Across all age groups in Canada, for pharmacist-administered influenza vaccines, there was an increase in overall vaccination rates was reported. Vaccination rates in older people were increased in parts of the country where pharmacy vaccination clinics were introduced. And also in the United Kingdom, influenza vaccinations were first nationally commissioned in community pharmacies during the 2014 to 2015 flu season. As a result of community pharmacists reported high influenza vaccination uptake among those aged less than 65 and also at high risk groups. So we saw more influenza vaccine uptake in community pharmacy in these groups. Community pharmacy vaccination services were highly accessed by patients from all socio-demographic areas in the United Kingdom. They were particularly attractive for caregivers, frontline healthcare workers, and those of working age because most likely of accessibility. And last but certainly not least, in the United States, nationwide, about 85% of public health programs have collaborative efforts with community pharmacies. Pharmacists' role in improving rates of vaccination during the pandemic was also demonstrated in a study that reported a significant increase in vaccination capacity. And that showed a reduced time to achieve national vaccination coverage. 18% of all influenza vaccinations were administered in community pharmacies in 2011. And in the last 4 years after 2011, up to 2015, there was increased to about 25% overall. And this may be even higher now. So overall, we can see a worldwide benefit of pharmacists providing vaccination. So what is the public health benefit of pharmacists and immunizers? They can improve vaccine-related health literacy and vaccination coverage rates. They can remove barriers and obstacles to the access to healthcare settings offering immunization services. They can counteract vaccine hesitancy. So again, pharmacists can inform patients about the safety and efficacy of available vaccines, address their concerns and fears, and display common myths and misconceptions, allowing patients to make more informed decisions about vaccination. So again, pharmacists play a major role in as immunizers in the public health framework. Now, vaccine hesitancy, again, as a reminder, it refers to delay in acceptance or refusal of vaccine despite availability of vaccine services, as defined by the World Health Organization. It's influenced by many factors in the society and in the community. So vaccine hesitance is influenced by many factors, And the three major society factors are confidence, complacency, and convenience. And you may see this throughout the COVID-19 vaccine certificate program, how these important factors are always a part of vaccine hesitancy. So when we talk about those three factors, confidence refers to the trust in the vaccine itself and providers to administer vaccines and the development and approval process of vaccines. So from a confidence standpoint, the patient may be thinking the following: is the vaccine safe? Is the vaccine effective? Can I trust the system and people who deliver the vaccine? Are they reliable and competent? Can I trust the policymakers surrounding vaccinations? Can it be trusted? Confidence may be a major factor. Complacency refers to the perceived risk of vaccine preventable disease are low, and our vaccination is not deemed a necessary preventative action. So some patients may feel that, the risk of getting a vaccine preventable disease is low overall. So the patient may relieve, for example, thinking about COVID, is the risk from contracting COVID as high as it is? Or catching COVID, will I get really sick? Or will I not get sick at all? They may think I may not get sick. So there may not be a benefit of me getting a COVID vaccine. That would be an example of complacency. Convenience. This is the degree in which vaccination services are delivered at a time and place in a way that is considerably affordable, accessible, and convenient. So convenience refers, does the patient believe or understand or feel that they are physically able to get vaccinated? Can they afford to get vaccinated? Do they live in a region or community where it may not be possible to get vaccination? What about the quality of vaccination services? Is it appropriate? In a time and place getting the vaccination, is it appropriate? These may be some factors as it relates to convenience. How do we apply these as our role as community pharmacists? Well, when we talk about confidence, pharmacists are trusted sources of information. And also community pharmacists have built a relationship with patients. So if there's a trust concern or a concern about reliability or competence, the pharmacist's voice as being trusted in the community can actually work and discuss confidence and maybe kind of have a discussion of the barriers with the patient. Complacency, so the perceived low risk, the pharmacist has a service as a health advice influencer to the patients. So a patient may feel that they are low risk, but the pharmacist can provide the facts of the matter and discuss who's at risk in certain vaccine preventable diseases. So for example, in COVID, we know or have recognized that patients with chronic disease stage like diabetes and hypertension may be at higher risk of worse outcomes with COVID. And a pharmacist's role can be here in the pharmacy discussing the benefits versus the risk of getting vaccinated and actually discussing, no, you may be at higher risk of getting COVID or becoming seriously ill from COVID. So the vaccine may be recommended for you because of the education and being a health advice influencer. Convenience, as we reflect, pharmacists are uniquely positioned in the community. They are readily accessible to patients in person or via phone. So they are readily available healthcare providers that can be available to provide vaccination and also answer questions as well. So these are ways pharmacists have a role and how they are central to addressing vaccine hesitancy. Now let's take a moment to reflect. The question is, have you encountered any of these three vaccine hesitancy factors, confidence, complacency, or convenience, while talking to patients about COVID-19 vaccination? So reflect on patients you've seen in the pharmacy and what have been the concerns about getting the COVID-19 vaccine? And what would it fall into? Confidence, complacency, convenience, or maybe multiple of those. So hopefully you can reflect on which one of those three you've seen or encountered with patients. Now will be a time to think about pausing the video and reflecting about those three factors. Now we're going to talk about success stories. Has there been any evidence of pharmacists' impact on improving vaccination uptake? And the answer is yes. There have been some very interesting studies out there. And we want to take a look at how pharmacists have made a positive impact on improving vaccine uptake in their communities. So let's take a moment to look at these. The first study is the effect of pharmacist intervention on the herpes zoster vaccination in community pharmacies. This was published in 2013. This was the interventional study conducted in the United States and Tennessee from 2007 to 2008. Pharmacists promoted the herpes zoster shingles vaccine through several different interventions. They provided a press release to local newspapers about herpes zoster, about the risk of contracting it, who's at risk, the symptoms of somebody getting it, and also how can vaccines have a role in preventing disease from this. Also, they provided patients at the pharmacy with a flyer with each prescription they dispense about the herpes zoster vaccine. And also for patients that were eligible per their records, they sent a personalized letter that was mailed to patients who were eligible for the herpes zoster vaccine. So those were the three interventions. The results of this study, the herpes zoster vaccination rates increased about more than 1%. Patients indicated that they were educated about the herpes zoster vaccine by the pharmacists more than any other sources before. And there was also influence to receive the vaccination as a result of the pharmacist-driven interventions more than by physicians. So patients were more influenced by their pharmacists to think about the herpes zoster vaccination. Another study published in 2017, evaluation of inpatient influenza and pneumococcal vaccination acceptance rates with pharmacist education. This was a pharmacist-driven vaccination education program. This was actually inpatient. They targeted patients who declined vaccination or hospital admission. As we know, when patients are admitted to the hospital, their immunization schedule is assessed, or if they're eligible for vaccination, the patient is asked if they want to get the vaccine. And specifically here, they were looking at the flu and pneumonia vaccine. So they targeted patients who declined vaccination. Pharmacists in the hospital educated patients in person. Pharmacists or pharmacy interns and re-offered vaccination, and also provided patient education sheets to patients with pharmacist counseling. In this study, with these interventions for both influenza and pneumonia vaccine, greater than 20% of patients that were counseled agreed to receive vaccination that had already declined it previously. So they actually got vaccinated after talking to the pharmacist or had a one-on-one education from the pharmacist. There was a trend toward increased pneumococcal influenza vaccination acceptance rates for any patients who had initially declined. So we see the impact of the pharmacists providing health promotion or education about vaccines and improving vaccine uptake in this particular study. So people had declined, but when they spoke to the pharmacist, got educated, more people decided to get vaccinated for flu and pneumonia shot. In this next study published in 2009, this talks about the impact of community pharmacists advocating immunization on influenza vaccination rates among the elderly. So there was 39 community pharmacists that targeted patients above the age of 65 eligible for the influenza vaccine. The intervention, pharmacists did the following to improve influenza vaccination rates. They displayed educational posters in the pharmacy. They discussed risk and benefits of the vaccine, and they provided educational leaflet to patients in their pharmacies. As a result, in the study, vaccination rate over time was significantly higher in the pharmacist intervention group versus the non-pharmacist group in the elderly. And also the rate of influenza infections were lower in the pharmacist intervention group because of the higher number of vaccinations. So as we can see in this study, in the pharmacist group, more elderly people decide to get the influenza vaccine based on more education, discussing the risk and benefits of the vaccine in the educational leaflet. Now, when we talk about COVID, we know the COVID pandemic is still relatively new, and the data about how pharmacists have impacted vaccination is forthcoming, but we can definitely observe our role in providing the COVID vaccine. The community pharmacy has made a benefit of getting people vaccinated in our state and maybe worldwide or in the country. This was a study that was published recently in 2021 in November that looked at surveys of satisfaction. Community pharmacists administered COVID-19 vaccinations, a pilot customer survey on satisfaction and motivation to get vaccinated. There was a pilot survey to find out about COVID-19 vaccinated customers' thoughts about getting vaccinated at the pharmacy. So they surveyed 370 patients that got their COVID shot at the pharmacy, and they asked them questions about the service. What were their thoughts about getting the vaccine from the pharmacy? In the study and the results, there was higher levels of satisfaction. More than 95% were satisfied with the pharmacist's education information level about COVID vaccines with them. the general comfort with getting the vaccine from the pharmacy, and also the injection technique. The top reasons for getting the COVID vaccine from the community pharmacy was the easy opening hours or flexible opening hours, ease of access to the pharmacy, and also perceived trust. So as we see, those themes are coming back again. Accessibility, easy opening hours, ease of access are very important to patients. And so we see in the COVID pandemic, patients reported high levels of satisfaction in regards to receiving the COVID vaccine from a community pharmacy in this study. So what do we take home from seeing this evidence? Pharmacists can play a significant role in improving patient treatment, adherence, and outcomes associated with vaccines, leading to increased vaccination uptake. Most patients are generally satisfied with receiving vaccinations in community pharmacy setting. The key factors of pharmacy interventions leading to improved vaccination uptake. So what the pharmacists did to improve vaccine uptake, there were several key central things here. Direct counseling and patient education was very important, as we saw in the studies. Patient-provided educational brochures or leaflet were important as well, too. It's also advertising the vaccine in the pharmacy were three major factors that played a part in improving vaccine uptake. Now, based on what we looked at in the success stories, we should reflect about, are there any takeaways we can use in our pharmacy? What were the key interventions we just discussed? Are there any interventions that pharmacists did in these past studies that you could potentially implement to improve COVID-19 vaccine uptake and other vaccines in your pharmacy? In the previous studies, the ones we just looked at, are there any take-homes that you can possibly easily implement in your pharmacy that may increase vaccine uptake? So this is a time to kind of think about pausing the video and talking about these interventions you can implement in your pharmacy. Now we're going to move on to ways pharmacists can promote vaccination health maintenance. The studies we just saw, communication and education was very important for vaccine uptake. Now we have to discuss how to promote vaccine health maintenance. Well, one thing we have to reflect on is, the patient-specific factors influencing adult immunization practices. What are our patients thinking about when they're thinking about, should I get vaccinated or should I not get vaccinated? Well, there's about four major themes that we should think about here, okay? The first one is the doctor or healthcare provider recommendation. Studies have shown if a doctor or healthcare provider recommends a vaccine, that could be a big factor in influencing if a patient will get vaccinated. Doctor or the healthcare provider could be a pharmacist. As we've seen, the pharmacist's voice is as important in recommending vaccination. So a lot of our patients rely on a person with medical expertise or the trust of a provider in direct education. So provider's recommendation is a strong influencing factor for receiving vaccination. Another reason is knowing why I should get this vaccine. So patients want to know why should I get it. It's one thing to say you should get this vaccine, but explain to me why do I need to get this? So rationale, how does it improve my health? How does it prevent me from getting sick? Are central things patients want to know and to help them think about how should I get vaccinated. Also knowing specifically which vaccines I need. So discussing the CDC recommendations, the timing of when to get vaccines, those that are seasonal like flu or non-seasonal, like herpes zoster. So knowing which vaccines I need and when is an important factor on thinking about should I get vaccinated. So people that get the influenza vaccine, when they start hearing about the months August, September, automatically, okay, it's around that time I should be heading to the pharmacy getting my flu vaccine. So knowing which vaccine I need is a very important factor. And last but certainly not least is, will I get sick from the vaccine? So side effects from the vaccine are a very big concern for my patients, and I'm sure you guys have seen this as well. The adverse effects would affect me after I get the injection. Will I get a disease from the vaccine? A lot of our patients still feel they will get the flu from the flu vaccine, as you guys talked about in your focus groups. That's a very important thing. So these four things are central to a patient in discussing vaccine or they're thinking about should I get vaccinated? So we should revolve around these specific factors. Some other things that may play a part are cost. Family or cultural beliefs may play a part as well. Some patients do worry about the other ingredients in the vaccine, what is actually in the vaccine, and also access. Those are some other factors as well. But these four are the major ones that have been shown in the evidence. The doctor, healthcare provider recommendation, knowing why I should get the vaccine, knowing which vaccine I need, and will I get sick from it. So when we talk about COVID, there is limited evidence on which interventions have been most successful in improving COVID-19 vaccination uptake. However, some things are going to be central. So vaccine education is going to be a big part to improve vaccine uptake. Healthcare provider influences, direct patient counseling and education, and also community outreach are going to be four central things that improve vaccine uptake. And that's probably not going to change a whole lot with the COVID-19 vaccination. These are four central things to improving vaccine uptake in the community. So from a pharmacist standpoint, how to talk to patients about vaccinations? Well, things to keep in mind, vaccine hesitancy is a major health threat that can undermine a community's ability to attain herd immunity to protect against preventable illness. Understanding hesitancy in communities is critical to maximizing community immunity by convincing those who remain unvaccinated to get vaccinated. So understanding vaccine hesitancy and why people are hesitant is very important to understand why those who remain unvaccinated or do not want to get vaccinated. There are some simple tools to assist pharmacists engaging with conversations about vaccines with community members, and we will talk about it. One tool that we have is the ASPIRE framework for pharmacists. The ASPIRE framework is a 6-step action list to support pharmacists communicating with their community members who may have concerns about vaccination. The goal of the ASPIRE framework is to share trustworthy health information with patients about vaccines and increase vaccine uptake. Again, a 6-step action list that pharmacists can use in talking to community members and patients and talking to them about their concerns about vaccines, sharing trustworthy health information with them about vaccines and increasing vaccine adoption. So let's talk about the ASPIRE method 6, ASPIRE, A-S-P-I-R-E. So the A is assume people want to get vaccinated and be prepared for questions. Pharmacists can assume that people want to get vaccinated and be prepared for questions. Hearing from multiple trusted sources and having repeated conversations with patients are needed to influence a movable middle. Those in the population who can change their mind, who have not yet made up their mind about vaccination. Now that there are about 3 COVID-19 vaccines available and boosters are recommended, of course, in subpopulations, a lot of people are going to have a lot more questions about the COVID-19 vaccine. Even though it's been out for some time, people are still going to have questions as we know COVID is rapidly changing right before our eyes. So assume people want to get vaccinated and be prepared to answer their questions. The S refers to share key facts and source information to counter misinformation. So when we talk about the S, pharmacists have been trained on what, when, and how to administer recommended vaccines. While doing so, they can share key facts and credible sources of information to counter misinformation. So it's very important to give facts and also address vaccine myths. So sharing key facts is very important, and confidence in sharing is very important. The P, present strong recommendations and stories about vaccination experiences. So pharmacists are important touch points, and they can present strong recommendations to vaccinate and stories about vaccination experiences. Pharmacists offer a convenient and safe environment to have meaningful conversations in a familiar setting where patients, consumers are comfortable asking questions within their own neighborhoods. So pharmacists should present strong recommendations and discuss their stories about vaccination experiences. And remember from the fall, a lot of you guys talked about your experiences with giving patients vaccinations, and that was very important. And we want to keep in mind to be able to discuss our vaccination experiences. So initiate discussion or address questions about side effects proactively using credible sources. So pharmacists can proactively initiate conversations with their patients about vaccines and engage with patients. As we know, there's a lot of information going on in social media and online about what may or may not be true about COVID-19 vaccination. So it's important that we can address the facts and provide credible information so patients can make an informed decision. They may decide to get vaccinated or even they may not. But our patients, whether they decide to get vaccinated or not, should be well informed with truthful information to make a well-informed decision. Or respond to questions and actively listen. So pharmacists are well positioned to respond to patients and actively listen. Picking up routine medications from pharmacists may be the only touch point with a healthcare professional for those who do not regularly see a primary care provider. So we definitely want to actively listen and respond to questions patients may have. And E, empathy. So empathize and understand concerns. Trusted relationships between pharmacists and their patients and pharmacists are cultivated over years through repeated visits to pick up medications. Pharmacists can use this safe space to share accurate health messages, empathize with patient concerns, and engage in dialogue about vaccination regularly. So these are your 6 steps, Aspire. So as we saw in the studies earlier presented, there were some times where pharmacists use educational materials to talk about vaccination. So we should be able to identify quality materials. What should that material include if you use a patient leaflet or brochure? Of course, first of all, we want to identify the target audience and establish trust when we have communication materials to address vaccine hesitancy. The material should address both the risk and benefits of vaccination. We can't just all talk about the good things about vaccination without talking about the risks, the side effects. We have to talk about that. We have to talk about everything and be inclusive from that standpoint. We want to give facts about vaccination, then address the vaccine myths. Visual aids are very important to our patients, and it helps them understand more, especially those with low health literacy. And also, we want to look at the communication prior to launching. So our pharmacy team members, especially the pharmacists, should assess if this is a good brochure before launching or using it in the community pharmacy setting. So there are some examples of things we can use to educate our patients. This is one such brochure. A common question we get from patients is, I don't know what's in the COVID vaccine, so I'm not willing to get vaccinated at this particular point. Well, here, this is one brochure that's available through the NIH and National Institutes of Health website that talks about what's in a COVID vaccine. So it talks about, the role of the mRNA. It talks about other things in the vaccine, the things that promote absorption of the vaccine itself. So, and it talks about even address the myth, what isn't in it as well too. This brochure is very straightforward, easy to read, and this can be beneficial to patients in making their decisions. And the links of really good information we can present to our patients are at the end of this presentation as well. So this is one example that talks about what's in a COVID vaccine. Another brochure we have available here is COVID-19 vaccines, what you need to know. Again, another brochure, very straight to the point. This comes from the Community Engagement Alliance Against COVID, CO, that works closely with communities hit hardest by COVID-19. On this website, you can find FAQs, fact sheets, and other resources you can share to provide accurate information and encourage people to get informed and take steps to overcome COVID-19. The website links, again, are available at the end of the presentation. Now we're going to go forward and talk about strategies to incorporate vaccination education and promote COVID-19 vaccination to community pharmacy. So far we have discussed the pharmacist's role in vaccination and how to promote health maintenance and look at some success stories. Now we'll discuss strategies to incorporate vaccination education in the pharmacy workflow. It is definitely understandable that pharmacies are very busy places, maybe now and maybe more than ever before. But there could be opportunities for very small and stepwise approaches to improve vaccine uptake in pharmacy and educate patients about vaccines, especially COVID-19 vaccination. And again, I definitely want to acknowledge the challenges that are faced in community pharmacy setting. Some barriers you guys talked about in your focus groups this year were time, of course, is a very big barrier. Staffing challenges, large prescription volume load, and also lack of support from maybe leaders in some cases or some challenges from that standpoint. I was so happy to meet with all of you guys on the phone, and I sincerely enjoyed getting your perspectives on providing vaccination. So how do we overcome those barriers? Well, what are some things we can keep in mind in maybe taking the steps forward and promoting more vaccination in the pharmacy? Well, we have to keep in mind our goals. So things to keep in mind, you want to plan and strategize. Some days are just so busy, it may not be a good day to do vaccine uptake or vaccine outreach as much as some other days. So think about days of the week that may be better to plan and strategize to promote more vaccine uptake or get plans in place. You want to maintain open lines of communication with the pharmacy team, discussing with the team that we're planning to improve our vaccine uptake by having more education. Of course, in these challenging times, it's very good to maintain a positive attitude with our team and our staff and having more challenges in these barriers. And we also want to encourage teamwork among the staff and also set clear pharmacy goals as it relates to vaccination, promoting vaccination. One thing that kind of resonated with me in meeting most of you guys in the fall in the focus groups was many of you stated it was sad to see members of the community that had passed away from COVID or had lost a loved one from COVID. And possibly if he or she was vaccinated, it could have been a preventable death. Going forward, we have to kind of keep in mind these things. We need to reduce the events and protect our patients. And through it all, we can make an impact through our challenges. So keep in mind, the main goal is to optimize patient care and protect your patients from vaccine preventable disease. So what are some best practices to encourage vaccination in community pharmacy? Well, one thing to keep in mind to put some things in place to improve vaccine uptake in your pharmacy, think about forming a vaccination task force so everyone can have a role in promoting more vaccines or providing more education about vaccination. So the pharmacy staff each has a small role to help with promoting COVID-19 vaccination and other vaccinations in the pharmacy. And this team consists of everybody in the pharmacy. The pharmacy technicians, the staff pharmacist, of course, will be the lead. Pharmacy intern has a significant role, and even the person, the pharmacy cashier that checks people out at the front, that they all can have a role in the task force, and we'll see some examples soon. So what can be some benefits of forming a pharmacy vaccine task force? We can have shared responsibility, so it reduces the workload on a single staff person. It builds teamwork and leadership skills, and everyone is involved in focusing on customer service and patient outcomes. And everyone gets more knowledge about vaccination through this process. So what can be the roles of a pharmacy vaccination task force? Everyone can have a role. For example, the pharmacy technician could be responsible for communicating with customers about vaccine availability and provide the vaccine educational leaflet. They can also monitor vaccine inventory and also monitor when there's a need to increase our supply of vaccination. So this person can be responsible for vaccine inventory and also communicating with patients about vaccine availability and providing the educational leaflet. The pharmacy cashier, they can make sure there are adequate vaccine education materials in stock in the pharmacy. So when there's not enough educational leaflets, they can print more or get access to more. They can direct the patient to the pharmacist if you have vaccine questions. They can be responsible for developing ways to promote vaccination in the store. For example, catchy posters or slogans or logos that can be posted throughout the pharmacy to promote more vaccination awareness. So the pharmacy cashier can have this role. The pharmacy intern, which is a pharmacist in training, of course, they can have significant roles, and this can be a really good learning experience for the pharmacy intern. So they can research and decide on the vaccine educational materials for the pharmacy. They can go to the website and enhance their drug review or literature review skills and find out what's the best educational materials for patients to use in the pharmacy. They should monitor the CDC vaccination updates and patient eligibility, and also counsel and answer patient questions with the pharmacist. So this can be a good leadership role for the pharmacy intern, a good learning experience for the pharmacy intern by forming or being a part of the pharmacy vaccine task force. And of course, the pharmacist would direct the task force, of course, counsel and answer patient vaccination questions, and also do a quality improvement check, a routine quality improvement of vaccination promotion and monitor vaccine uptake. So how is the task force going? Are we getting some positive reviews from the patients? Or have we noticed vaccine numbers have improved based on what we have done in our task force? So these are things each person can have a role as part of the task force. And we can talk about that promoting vaccine health maintenance into the pharmacy can happen throughout the pharmacy. We can have roles to talk to patients about vaccines at pickup and drop off, drive-through, counseling, and also through our health and wellness calls we may do. There may be opportunities for vaccine outreach and promotion. And we'll discuss each one of those individually. So at pharmacy drop-off and pickup, this will be a moderate amount of time for outreach and engagement. So the patient comes to the pharmacy to pick up and drop off their prescription. We can have some small dialogue about vaccinations available and also thoughts about getting vaccinated. So what are some things that can be done, opportunities? Well, the technician or the person that's checking them out, or if they're picking up prescription, can inform the patient about vaccine availability in the pharmacy. So knowing that we have the COVID-19 vaccine available, or we have the influenza vaccine available, we definitely want to make sure we communicate that at pickup and drop off. As we saw in the literature earlier, vaccine educational leaflets and handouts with recommendations can be available for the patient on the spot. Once they pick up a prescription, they can get a handout about the vaccine that's available and the benefits, risk, of why they should get vaccinated. And also they can be referred to the pharmacist if they have any questions about vaccination at the pharmacy drop-off and pickup window. So there's a moderate amount of time for outreach and engagement here at the drop-off and pickup station. Now, drive-through, you're going to have a short time for outreach here. Of course, being a person that has practiced community pharmacy myself as well, we definitely want to have, for stores that have a drive-through, we want to definitely continue to maintain movement in our drive-through. So this is another place where patients pick up and drop off prescriptions. So that's kind of some brief, very brief touch points we can do to drive-through. So the person that's helping them or picking up their prescription and dropping off their prescription, the person that's working the pharmacy or working the drive-through should inform the patient about vaccines available when they're available. So if we just started our flu season, letting the patient know that the flu shot is now available. And also maybe provide a vaccine educational leaflet, a handout with recommendations when they're picking up their prescription as well. So very quick things that don't prolong our time in the drive-through for our patients can actually be beneficial. So small interventions like this could get patients thinking more about vaccination. What about the consultation window? There could be more time for patient outreach and the pharmacist's involvement. So there can be some time for vaccine question and answer. Excuse me. They can discuss COVID vaccination and boosters. And here will be a good way to discuss, the pharmacist can use the Aspire approach to talk to patients about vaccination here in the counseling window. So it's a place for one-on-one questions with pharmacists to gauge their thoughts about vaccination. A good place to kind of educate patients about vaccination as well too. Now, some pharmacies are conducting health and wellness calls where the pharmacy contacts the patient for their refill reminders, their first fill follow-up. These could be opportunities to promote vaccination as well. So whoever's doing those calls should review the patient profile for vaccine eligibility and discuss that during the outreach call. So when we're calling for, does the patient want to refill their medication? There may be an opportunity there to discuss, you're eligible for this vaccine based on your patient profile review. And also discuss the role of vaccination for maintaining patient health and wellness, and discussing pharmacy vaccine availability. And also in some of our chain pharmacies, some systems may already be set up that way. When you're making a first fill call, it may link to this person may be eligible for a vaccination, or when you're taking refill calls, it may say this person is eligible for this vaccination. So it's important not to ignore those prompts. We can actually apply it to our patients when they call. So overall, with vaccine promotion in the community pharmacy, planning is key for success. You want to make strategic decisions. Think about the best days for the vaccine task force to meet and make some interventions or have some opportunities. Develop a vaccination promotion plan. What are maybe 2 or 3 things, or maybe even more, that you can do in your pharmacy to improve vaccine uptake? Education, more educational leaflets, reach out to patients, or having any type of outreach to patients. Also, you want to maybe streamline your in-store vaccination process to maintain and improve customer satisfaction. So if we're having more vaccine uptake, is it easy for that patient to get in, hopefully not have much of a wait time to get the vaccine? So we want to make sure our in-store process is well maintained and streamlined. So overall, pharmacists are uniquely positioned to improve the immunization rates and public health efforts. Community pharmacists motivate patients to receive immunizations by serving as immunization advocates in the role of educators, facilitators, and immunizers. There are still many opportunities to improve the health of patients through COVID-19 vaccination and uptake of our routine vaccinations in the pharmacy. So overall, we have success stories where our pharmacists improve uptake, key things, education, counseling, providing educational leaflets, advertising in the pharmacy. These things have been shown to improve vaccine uptake in the pharmacy. So hopefully we can apply some things we learned from this presentation into our community pharmacy work going forward that may improve vaccine uptake. Additionally, for more information about the educational leaflets and brochures, we have several different links in the presentation. So we have the Immunization Action Coalition Vaccine Hesitancy Summary Resource List. There's a link that we have educational leaflets and handouts for patients. The SEAL, NIH Community Engagement Alliance Against COVID Disparities, has a website with information. There's a website from the CDC that addresses myths and facts about the COVID vaccine. The CDC in general has a hub of different things about COVID vaccination. And also APHE has a vaccine hesitancy guide as well too. So we have many different things available for pharmacists. With that said, I really want to thank you so much. If you have any questions, you can please post in the discussion board or reach out to me directly. I really hope that you got something out of this presentation. Again, want to thank you guys so much for your work as frontline responders. We really have had a positive impact on vaccine uptake. And we definitely want to make sure we continue to protect our patients from vaccine preventable diseases and also COVID, as it seems like it's continuing to be a challenge these days, especially for those that are not vaccinated. I want to end by saying we have the power to educate patients, to talk to them about vaccines, talking about the facts and myths. There may be some patients that have made a decision, I do not want to get vaccinated. But we want to make sure they have been informed about everything they need to make an informed decision. And we have a role. And remember, in the presentation we saw that the pharmacist's voice is as important as the healthcare provider voice in helping patients make decisions about vaccination. So with that said, I want to thank you all so much for listening to this presentation. Again, if you have any questions, please feel free to reach out to me, and I thank you so much.